Okay, thank you, Christy. So this is going to be relatively brief, and I'll certainly open it up to questions. With respect to our COVID-19 activity, I don't have all of our hospitalization data back yet. Just to let you know, we'll update you as soon as we have all of those data back. It's just with a long weekend, there's sometimes a delay. But at this point, everything continues to look stable on the COVID-19 front. With respect to the number of new cases, we're at just under 500 new cases reported. Again, with the caveat that we know that that there are many more cases occurring than those that are officially reported because people are doing their home tests. From the hospital data that we do have so far, it looks like we're about on par with last week. So again, everything fairly stable. And unfortunately, we have continued to have deaths associated with COVID-19. So we're currently at 1,012 deaths associated with COVID-19 in terms of residents of the Roanoke City and Alleghany health districts. What we do know, if we look across the country and across the HHS region, that right now B4 and B5 are the predominant circulating strains. These strains are not felt to be more dangerous than the previous Omicron strains. So these are strains of Omicron. They appear to be as transmissible as the BA2 and BA212, and they do evade some of the antibody response to both prior infection and to vaccine. And so that's probably one of the reasons why we continue to have this virus continue to circulate in our community. We know that vaccines continue to be safe and not ideally as effective as we would like them to be, but they're still our best tool to decrease the impact of COVID-19. So that's really the COVID-19 situation in a nutshell. We're at stable activity with B4 and B5 as now combined the predominant circulating strains. With respect to hepatitis A, it's a similar situation. It's a very steady state right now where we have 2 or 3 cases reported every week, whereas in the past we would see 2 or 3 cases reported every year. So we're currently at 72 72 new cases of hepatitis A since January, with 52 hospitalizations. And so with that, you know, unfortunately, I can't say that we're making improvements on either front, but similarly, there is no significant increase in the severity of either of these outbreaks. So with that, I will open it up to any questions and I will monitor the chat. Yeah, so the 20% positivity rates for the tests in Virginia, I think, Jean, that's most likely due to the B4 and B5, the circulating B4 and B5, which we knew were coming. We saw that in South Africa, and we were expecting them to come here, and they've been circulating for a while, and they're gaining steam, just as prior to that, B2 and B2.12 gained steam, and prior to that, it was regular Omicron, and prior to that, it was Delta. So we're just in this constant flux of new variants coming, and every time there's a new variant, it impacts our disease trends. So I think that most of us are attributing the positivity rate to the increased circulation of the newer variants of B4 and B5.
Dr. Morrow, it's Leanna with WDBJ7. Is there any information to indicate that B4 and perhaps B5 are any more or less severe than the earlier variants of Omicron?
No, at this point, the data that we do have available shows that they are approximately the same as what we've been seeing with B2 and 2.12. And certainly with our data, assuming that the proportion of variants that are circulating in the Roanoke City Alleghany health districts are similar to the HHS Region 3, which is the smallest area that we have for variant proportions. And I'll put a graphic in our data sheet today. There's no reason to believe that these are more severe. And when we look at our hospitalization data, we're percolating right around 15, 16 cases per week over the last few weeks. I don't have all of those data back yet, but of the hospital data that we have, it looks very similar to what we've seen over the last few weeks. So I think that both our local data, the national data, and the international data are showing us that these two circulating strains are not significantly different in terms of virulence compared to the B2s.
A follow-up question regarding vaccines. Since those vaccines for kiddos under the age of 5 were made available and have since been distributed in the health districts, can you talk to us a little bit about the vaccine uptake for that age group?
Yeah, I don't have good numbers yet. I can tell you that we've had nice uptake here in our community in terms of just filling our clinics, but we have small numbers, and we knew that the numbers would be relatively small. So I think that it's not, we are seeing uptake. It's not a huge amount of uptake, but we are seeing parents who want to protect those youngest children. I'll try to get the numbers, but I think it's important to know that because this is so new, they're probably going to lag a little bit. And just as an example, we've been providing, maybe 20, 30 shots a day on the days that we're vaccinating our littlest ones. So I think that those are a couple of questions in the chat as well. There's also a question in the chat about when another round of booster shots will be encouraged. We don't know. There's certainly discussion right now that changing the strains a little bit, just as we do with influenza every year, we change up the influenza vaccine to best match the circulating strains. Certainly the idea is for the fall rollout, assuming that there'll be a fall rollout, that it will have a vaccine that includes better protection against Omicron. But that's all speculation at this point. There is no FDA approved next dose, and we're just going to have to wait for the process to unfold as it should. We need to wait for the FDA to approve a next round of vaccine. We need to wait for the CDC, the Advisory Committee on Immunization Practices, and then BDH to approve it. And actually, that was the next question, a more targeted booster for Omicron. We need to wait and see what happens, but I think that is I think that the goal, looking at FDA, looking at CDC, looking at World Health Organization, is to have the vaccine adapt as this has become part of our ecology, just as influenza is part of our ecology. And I do think that most of us think that there's going to be an annual type booster, but this is all speculation. We're going to need to let those processes unfold. So any other questions about hepatitis, about COVID?
How about monkeypox? We saw that there was one case in Southwest Virginia. Can you say if it was in your district? And are there things people should be worried about now that it seems like there are other ways of contracting this other than close, intimate contact?
Well, I think it is important. So first of all, the Virginia Department of Health at this point is only releasing the numbers at a region-wide level. So the only thing that I can say is that there has been a confirmed case in Southwest Virginia. In terms of close contact, it is important to keep in mind that, so if we look across the globe, there have been over 5,000 cases. If we look here in the United States, there are currently 460 cases of monkeypox. If we look at Virginia, we're at 16 reported cases, including one here in Southwest Virginia. It is still overwhelmingly identified in individuals who identify as men who have sex with men. And it is definitely the most common source of transmission is direct physical intimate contact. So that hasn't changed. It is overwhelmingly direct skin-to-skin contact, or potentially what we call fomite. So if someone has lesions on their face, they share a pillow or a towel with someone else, the fluid from the lesions can get on the towel and then it can be spread that way. There are rare reports of prolonged face-to-face contact without skin contact, presumably some direct respiratory contact, but it does require prolonged face-to-face contact. So overwhelmingly, this is a disease that is transmitted by direct contact of someone who has lesions on their skin to someone that's that skin-to-skin contact. So it is overwhelmingly considered a direct contact transmission, although other sources, another potential source is from a pregnant person to the fetus, but overwhelmingly it's direct contact.
As we talked about hepatitis, of course, we're seeing a sharp increase in the numbers. Has there been a plan developed or being considered as a way to fight this?
Well, we've here in the Roanoke City Alleghany Health Districts, we've been really working hard with our community partners to increase access to vaccine, to increase awareness of the importance of getting a hepatitis A vaccine. We're also working with our central office partners to try to increase education and awareness. I think that for me, the biggest emphasis is to make sure that our food handlers are educated about hepatitis A and take every precaution that they can in terms of hand hygiene, following all of the policies, the workplace policies that they are required to follow, but certainly encouraging our food handlers, our restaurant workers to get vaccinated. We are continuing to be in an epidemic situation here with respect to Hep A, and we need people to get vaccinated.
Hi, Dr. Morrow. Leanna again here with WDBJ7. I suppose it goes without saying, but are you expecting to see a change in the COVID cases in the coming weeks because of the 4th of July holiday?
Yeah, I think that is a very reasonable thing. I think the other thing that we need to I know I've said this a lot, just to have ongoing humility about this virus. We don't know what's beyond B4, B5, but it's very likely that there's going to be something beyond B4 and B5. And so I think that we just need to continue to consider what our own risk tolerance is, what our own behaviors are. I think it is likely with the 4th of July holiday that we'll see increases. I also think that we may be seeing increases because of the B4, B5 changing proportions, even without the holiday. So how much the holiday is going to contribute, it's hard to know. Hopefully most people were outside, and we know that being outside significantly decreases the risk of transmission. But I think one of the things that has surprised me is how steady the pace of COVID-19 activity has been over the last 6-7 weeks. It is just percolating here, and as long as it continues to do that, we should all just be mindful of how it's transmitted and make the best decisions for our families. I don't envision a massive increase. I don't envision that we're going to see a dramatic increase in hospitalizations. Do I foresee it bumping up a little bit? Absolutely.
Thank you, Dr.
Sure. I wish I had more concrete information, but this continues to confound us. All right, I'm not seeing any other questions in the chat. Are there any other last minute questions? Okay, well, we'll send out the local data sheet, and I have included a graphic about the proportions in HHS Region 3. And if anything changes, of course, we'll notify you. Otherwise, we'll see you in a couple of weeks. And we won't send out those data sheets until we have all of our hospitalization data back in. But thank you, everyone, for helping us get good information out to the public.